Nephrology remains on the cutting edge of the movement towards quality-driven healthcare, and RPA continues to play a leadership role in this trend on behalf of the specialty. RPA, in partnership with the American Medical Association's Physician Consortium for Performance Improvement, began developing evidence-based physician-level clinical performance measures for ESRD and CKD in 2006. The collaboration has led to the development of 6 physician-level clinical performance measures for chronic kidney disease and 6 measures for end-stage renal disease. This group represents an initial step in a multi-year process of establishing a core set of process measures for improvement efforts, public reporting, accountability, or pay-for-performance programs. Ultimately, these process measures are expected to be widely incorporated into provider contracts and implemented in medical practices after undergoing testing to validate the feasibility of measure reporting. 9 of the RPA developed measures were included in Medicare's 2008 Physician Quality Reporting Initiative, and RPA anticipates an additional 2 CKD measures will be added for the 2009 PQRI program. All 12 measures have been adopted by the Ambulatory Care Quality Alliance. AQA is a broad-based national coalition of physician specialties, consumer groups, employers, health insurance plans, government agencies, and accrediting and quality groups. AQA's role is to reach consensus on measures and to facilitate their widespread implementation. 3 of the 6 ESRD measures, Hemodialysis Adequacy Plan of Care, Peritoneal Dialysis Adequacy Plan of Care, and Influenza Immunization, have received time-limited endorsement from the National Quality Forum. NQF is a multi-stakeholder organization that has been instrumental in advancing efforts to improve quality through performance measurement and public reporting. NQF endorsement involves a rigorous, evidence-based review and a formal consensus development process. This NQF process has become the gold standard for healthcare performance measures. NQF is CMS's preferred consensus organization for selecting measures for inclusion in Medicare value-based purchasing programs such as PQRI. NQF grants a 2-year time-limited endorsement for measures that have not been pilot tested. Each measure developer will be pilot testing their measures over the next 2 years to extend their NQF endorsement. NQF granted time-limited endorsement to 19 other quality measures specific to ESRD care. These were developed by either CMS, the Kidney Care Quality Alliance, which is a coalition of renal care organizations, or the Society for Vascular Surgeons. 4 of the 19 measures are physician-level measures, while the remaining measures apply to the dialysis facility. RPA and the AMA PCPI are testing the physician-level measures that were developed collaboratively. Under contract with the Iowa Foundation for Medical Care, RPA and AMA PCPI are assessing the measure's feasibility and reliability in diverse geographic settings, as well as validation of the PQRI claims data for those practices that submitted PQRI data in 2007. Throughout the fall, 4 nephrology practices representing both small and large providers, urban and rural practices with paper-based and electronic records participated in the pilot test to determine the applicability of each physician-level quality measure. The sites who are participating in the pilot test are Iowa Kidney Physicians of Des Moines, Iowa, Dallas Nephrology Associates of Dallas, Texas, Hypertension and Kidney Associates of Lancaster, Pennsylvania, and Sierra Nevada Nephrology Consultants from Reno, Nevada. RPA worked with the AMA PCPI and Iowa Foundation for Medical Care to develop the testing protocol, data collection tool, and data element tracking form that were used at each of the 4 practices. An abstractor team then visited the test sites to review 35 ESRD and 35 CKD randomly selected de-identified patient charts. Upon completion of the testing and analysis of the findings, RPA and the AMA PCPI will share the results with NQF. RPA will continue to maintain and modify physician-level quality measures to ensure that they are consistent with the latest scientific advances. Evidence-based medicine represents a significant development in the delivery of quality kidney patient care. Check RPA's website and RPA News for results from the pilot test, as well as additional information about the CMS Physician Quality Reporting Initiative as physician performance measures for nephrologists continue to evolve. Information about performance measure implementation will also be provided at the RPA annual meeting in March in Baltimore, Maryland.